Hi, everybody. Welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona and co-founder of Kidney Coach and the Kidney Disease Solution and our products Cargenesis. And I have the pleasure of being joined again today by one of my favorite guests and favorite people in the world, Dr. Morgan Camp. Hey, Morgan, how are you?
I'm doing great, thank you. Hi, Fiona, and hi, all your fans out there in the audience. Very happy to be here today. Thank you for having me.
So if you haven't listened to a podcast with Dr. Camp before, he is a functional medicine practitioner. He's been in the functional medicine field for well over 20 years. And you really got in there right from the get-go. You know, Morgan's got a great story that I think we dive into on some other podcasts, but he got into the functional medicine aspect very, very early on. So has been very much in this field. And just one of the things when you get to know Morgan and one of the things I really appreciate about you, Morgan, is that he really is a continual student, goes out and learns more and more and more and more. He knows so much on bioidentical hormones and longevity and infections and immunotherapy and detoxification and all those sort of things and stress-related illnesses. And then, just keeps expanding his knowledge. So every time I talk to Dr. Camp, he's gone down the rabbit hole of something new and amazing and is just learning every single thing he can about it so he can pass it on to his patients. So he's what I call a true healer, very, very good at getting to the cause, very, very interested at treating people as a person and not a disease, and really is invested in getting people super well and will go out of his way to learn whatever he can to help that happen for people. So that's a basic rundown without going through all the Western credentials. But yes, been a doctor for a very long time with a very, very special interest in a really cool way of working. So thanks again for spending your time with me today, Morgan, and with our people listening to talk about all things kidney disease. But we're going to dive into a topic that actually quite a few of my people from my mastery course have been asking me about, and that is the kidney-brain axis, which I've gone and looked and no one really talks about this. And one of the biggest symptoms that people with chronic kidney disease will talk about is the brain fog and the not being able to concentrate, and then actually also mental health disease that we do come along with this. And so I wanted to dive into this as a topic today. So first off, what is the kidney-brain axis? What am I even talking about when I put those two words together?
Good question. Everybody has a little different interpretation of everything, right? So, it's a complex. The way I think of it is our kidneys have many roles, right? I think in this context, one of the things we're talking about is detoxification of toxins and the things we need to get out of there. So from one very simple perspective, it makes common sense why we would have neurological symptoms when our kidneys aren't working, just because the toxins aren't being cleared properly. But it's actually a lot more complex than that, of course. What else? What else does that mean to you, Fiona? Interested.
Well, I think people are beginning to get familiar with the term the gut-brain axis. So people know, okay, this microbiome, we know our gut makes 75% of our serotonin, and we know that if the microbiome's out. And I think the other thing that people may or may not know is this leaky gut syndrome, where the gut lining that should look like this becomes like that. And we know that the blood-brain barrier up in the brain tends to mimic the gut barrier. So if you've got a leaky gut syndrome, I often say you've got leaky brain syndrome. And I think I
was going to say, and it's likely that there's some leaky kidney issue going on there also, right? Yeah.
That's exactly what I was about to say. I think when you've got leaky gut and chronic kidney disease, there's a leaky kidney going on. And I think with leaky kidney, we know the microbiome and kidney health are interrelated. I think when you're in chronic kidney disease, there's going to be probably an aspect of leaky gut going on because of what you mentioned with the detox, which is going to have this leaky brain barrier. So I think, it's that interplay that we're sort of looking at everything, right? So,
sorry, Fiona. Yeah. Sorry, there's a little bit of lag time. I did not mean to cut you off at all. My apologies.
No, you're the expert here. I was going to say, so talk to me about what, I think you were going to answer my question anyway, but let's dig into it on that level.
Yeah, the way I was thinking about this topic, and interestingly, I'm having pretty good brain fog here today. And just a brief aside to add to what you were saying about my path. I mean, I'm, my unique relationship to everything I talk about is personal. So, I've had personal experience with everything we talk about. My kidney function, I think the lowest it got down to was in the GFR in the 40s, I believe, high 40s. So that hasn't been the worst thing I've had, but most everything else I've had experience with, including brain fog, which I have some today. So I do think sometimes I actually could be more detailed when I have brain fog. Actually, I might have a little focus issues, so bear with me if I have focus issues today. The way I would break this down would be into two categories. Okay, so bear with me for a second. So there's going to be neurologic brain symptoms that are directly correlated to kidney disease. That's a section of what we're going to talk about. I think the larger group is the brain fog and neurological symptoms caused by the disease processes that cause the kidney disease in the first place, right? So the one thing I've come to appreciate lately is that everything I do in my practice prevents all illnesses, almost all illnesses. And I've been perplexed. I've been sitting here going, well, why don't I get patients in my practice who get kidney disease? Why don't I get patients who get cancer? Why don't I get these things? And now I'm realizing as I read more and dive into deeper things, people that I've worked with and I'm talking about people that I've worked for 10 or 15 years who we've really fine-tuned everything and got them in good health. What I've come to appreciate is a lot of them, they're in good health. And so we're preventing all disease processes on some level. I know it sounds a bit cavalier to say that, but I've come to this conclusion because I've been scratching my head for the last many years going, I don't really get too many cancer patients. And I don't mean cancer like new patients. I mean in my clientele. And I've been scratching my head going, I don't know why. I guess maybe I just take healthy people come to see me. It's a bias. That's what a scientist would say. It's a bias. And I don't get people that are going to get cancer. But I had a friend, I've had several friends with cancer lately. And so I've been researching it. And there's a big topic on this called the metabolic causes of cancer. And I'm looking at that book and I'm like, that's what I do in my practice. That's what I do. This is what they're treating cancer just like I treat every person now. So I'm like, okay, this makes a lot of sense. This is why I'm not seeing cancer. So long story short, I am learning to appreciate that the disease processes produce a myriad of symptoms. And doctors and patients alike, myself included, tend to blame all the symptoms on whatever disease we have, right? So we have kidney disease, and I've got a brain fog, it must be from the kidney. Well, maybe not, right? Why do you have the kidney disease? So that's how I would think about it. I had that epiphany today. So I thought it'd be wise just to start with that. And also, encourage people, to avoid that error of logic that most doctors make and most patients make, is that don't ascribe everything you have to that one disease you have, right? Maybe think of it a little broader. Is there another disease process happening, or is this maybe the underlying issue that's causing both, but it's not so I would encourage people to start looking at it like that. So with that in mind, the way I prepared for this was like, let's just go over all the causes of brain fog. And man, I've had them all. So it was pretty easy, just write them all down and go through them all. And even maybe if we have time, go over some like lab tests and how to distinguish between the different ones. So people have some practical tips for that. And it might be that we need to come back and do a second one or dive deeper into some of the deeper issues too. How does that sound, Fiona?
Sounds perfect. And that comes back to, treat the person, not the disease, cause not effect. So your brain just naturally goes into that process of just thinking and going like that. So I love it.
Thank you. Yeah. And of course, there are some, I want to end with this on that note. There are times when, of course, the kidney, like the uremic issues, so you're not detoxifying ammonia and other uremic compounds, those are going to interfere with the blood-brain barrier. Those are going to cause neurotoxicity and all kinds of problems. So yeah, for that, it's simple cause and effect on that level. And but I'd say that's, and those can be elucidated. One simple way to elucidate that would be protein in your diet, right? So one way to see if that's a main cause of your symptoms is to minimize protein for some period of time. How long would you recommend minimizing protein to see if that's the cause of your brain fog there, Fiona?
Oh, if you're just looking for brain fog, I would say you would know within 7 to 10 days, I would have
That's
thought.
what. Yep, that's what I was thinking too. Exactly. So to clarify that statement, what I'm saying here is, if you think your brain fog's from not clearing enough ammonia, which is a main, and other uremic compounds, which are the protein breakdown byproducts that aren't cleared when you have kidney disease. One way to figure that out is just lower the protein in your diet for a week. See how you do. If the brain fog clears, bam, you got it.
Yeah,
Yeah.
yeah, really good point. Yeah, so you
Yeah.
could follow, analog low protein diet and do that for 7 to 10 days. Brain fog gone. Okay, that's your brain fog's caused directly by uremic toxins. I love that. What a nice, simple way to figure that one out.
I'll add. I know too much I know too much to make any conversation simple. I know I must annoy a lot of people.
No, it's good.
That's not always the case. I mean, for example, I was just mentioning to you, I recently discovered I have this very rare disorder in which I cannot metabolize proteins. And when I do, I get an excess of one amino acid in my brain, which short circuits me. And I have to take take a drug that was created to clear this, and it works like a charm. So that's it. But that's a rare disorder, and that's a rare disorder around tetrahydrobiopterin metabolism called the symbol for it's called BH4. If you want to know if you have something like that, you get what's called a functional genomic analysis done. I prefer the one from Dr. Bob Miller and his group, because he specializes in looking at those pathways, and it is consumer available. The Intellex DNA also does the same level of analysis, but you have to go through a provider to get it. Yeah. Yeah.
Cool. Okay. All right. So we go uremic toxins. That's easy to test for. Lower the protein load. Let's see if it's that. But let's go through all these other potential causes that can also cause kidney disease and any chronic disease that can also cause brain fog. Let's dive into those.
Yeah, so I've got, we can group them several different ways. Start with hormones, easy one.
Mm-hmm.
Low thyroid, big one.
Yeah.
And how do you test for it? You get free T3, free T4, TSH, thyroid peroxidase antibodies, reverse T3. We could talk for hours about that one topic. When your thyroid's low, everything in your body will be low, including your kidney function, all your other hormones, everything else. Next, in men, especially low testosterone will cause brain fog. And in women, low estrogen and or low testosterone, I should say. Estrogen testing in women is much more complicated. Simple testosterone serum test works extremely well for men or women when you look at total and free testosterone. And the free testosterone is the one you really want to be concerned with. The total is less meaningful than the free. However, serum estradiol level, it's hit or miss, and there's day-to-day variation, and I don't see it correlating a lot with anything. For women, I prefer if they do a 24-hour urine test or the Dutch hormone profile. I find that to be the best test of estradiol testing. If you are having menstrual cycles, you typically want to have that done on day 4 or 21 of your cycle, somewhere around there. And if you're not menstruating, then it doesn't matter the day. So those are the main hormone imbalances. Of course, if you've got cortisol and adrenal issues, you'll have blood sugar imbalances and massive brain fog from that too. The best way to assess that is also with the Dutch hormone test, or either an adrenal stress index, it's called, where you do a salivary test at 4 to 6 times over the course of a day.
Yeah.
Those are typically, you can pick those people. The people who have low cortisol related brain fog are typically extremely thin, and they're the hangry types. They get really irritable and angry if they don't eat often enough. Then the next group I have here is occult infections. And all the toxins that come there. That's one of my specialties, and on the top of the list here, just so we don't forget it, but much beyond what we have time to talk about here today, is called cavitations, which is one of the most common causes of you can't figure out what's going on with somebody, and they've been to see every doctor in the world, and they've got teeth issues, then cavitations are high on the list. And the long story short of those, they're low-grade infections up into the jaw, potentially from hidden infections at the base of your root or root canals. They're frequently present where people had wisdom teeth removed, or if you had trauma in a tooth, or if you had a root canal. It's very hard to rule out a cavitation, meaning it's very hard to prove you don't have one or to prove you have one. So it requires a very high index of suspicion and a very high persistence level talking to your dentist to get that done.
Yeah.
Next, and very common, GI infections, right? Any number of parasitic infections, worms, protozoans, candida, fungal overgrowth, you name it, those cause issues. There are a lot of good GI testing services you can use now that have decent results. There is a negative. One of the big caveats with GI testing is people make the mistake of believing that a negative stool test means you don't have something, and that's not true. The literature says you need 10 negative samples to prove you don't have something. 10 people. 10 times you got to poop in that little thing and send that in before you can say for sure you don't have something.
That's an expensive way to definitely know, isn't it?
Exactly. Luckily, you usually don't have to do 10 to get to the point. But it's common, and I see that, and I've been treating that my entire career. And I've treated, and that would include things from H. pylori to Giardia to Candida, etc. And another way you can look at those, another way you can test and get information about GI infections indirectly is from an organic acid test. Like Mosaic Labs has something called an organic acid test. Genova does as well. And what those are doing, they're looking for the organic acids that are in your urine that come from yeast, fungus, and bacteria in your intestinal tract and elsewhere in your body. And guess what? Those same acids are what's causing the kidney disease. So if you see a lot of acids on that test, that's why you have to alkalinize. What does alkalinizing do? It's neutralizing all those acids so you can pee them out. Otherwise, the acids that you're seeing on those tests is building up in your body and in the kidneys and killing the kidneys, right? And also, it also often causes a lot of pain in people too, I found. Yeah.
No, that's exactly. I tend to use an organic acid test as a standard base in my longevity clients, and 9 times out of 10, you'll see the hippurate or the benzoic acid, elevated. And I'm like, okay, we've got some candida or we've got some sort of gut bacterial overgrowth. So we're starting there before you're allowed any peptides or fun stuff.
Exactly. You got to dig out the bad stuff first, right? Fix the foundation.
Exactly.
And then, other like low-grade infections would be neurological infections like Lyme disease, Bartonella, Babesia, Borrelia, those guys. Also can be low-grade viral infections like Epstein-Barr virus and other viral infections. And any number of infections fit in that category. One way to, there are no easy way to know if you have an infection or don't. There can be clues sometimes, if you go back through your history, did you have some illness and then everything got worse? So that's one way I go through with patients. Oh, okay. Do you remember when things got that brain fog started? Well, often they can't, but if we have the conversation a few times and ask them to really think about it, then as they get healthier, often they'll be able to remember, oh yeah, really started after I had that X, Y, or Z illness, or I was visiting that island and picked up something or another. So these are little clues when you look at your history. If you had an infection preceding some of these symptoms, then the infection is either the infection is still there, and or you got what's called a post-infectious inflammation, which is basically what we call autoimmunity. Autoimmunity is a BS term. It's not us attacking ourselves. It's us attacking what we think is an infection, actually. Yeah.
Yeah.
And that's what's
Thank you.
that's what's happening. Yeah.
Yeah. And I think, I think when it comes to autoimmunity, I don't know what you think about this, but because that's my area, is obviously I think almost all autoimmunity has to be set off by an infection, whether you've got molecular mimicry that stays from that or whatever happens. But the body is so self-governing and smart. It's never going to attack itself unless it's thinking it's doing a favor for you. And that generally will come from, unless it's a severe food allergy or some sort of infection. I think the underlying cause of pretty much most of our autoimmunity.
Exactly. I think the word autoimmunity is like one of these turn us against ourselves mind control operations, literally, like think that that our body is not intelligent enough that it would just attack itself. No, actually, it's all the toxins, chemicals, et cetera, everything else there that's screwing everything up, right? It's not our own system necessarily.
Agree with you with that one.
Any other infections that you can think of?
No, they're the big ones, like you say, the big Lyme, the BCR.
Yeah.
Yeah,
And,
even
yeah, and the one thing that I'm hearing that I forgot to really put in there. So, and we were alluding to this when we said the 10 stool test, and that's a joke, but not really, a little bit. Your primary care doctor at Kaiser is not going to tell you don't have Lyme disease. Your primary care doctor is not going to tell you don't have cavitations. What I'm saying is they're going to tell you that. That does not necessarily mean you have it or don't. If you think you might have an underlying infection, you have to see someone who specializes in that, who specializes in low-grade infections. Otherwise, you're going to get told repeatedly that it's all in your head and you're making it up. Even if you go see a mainstream infectious disease doctor. Now, some of them now are getting trained better and better, and they're also, I think, bringing their own experience to the table and on skepticism about some of the things they were taught potentially. So maybe they're a little more open-minded. But the real old school infectious disease doctors, I was taught no such thing as chronic Lyme. And all these other things. And hey, I picked up, I got bit by about 300 ticks when I was age 10, and that was the beginning of my health trajectory. So I have personal experience that refutes that idea.
Yeah, totally.
And then the next thing I have on the list is environmental toxins.
Mm-hmm.
And this is a long list, we could put glyphosate on there because glyphosate, if people don't know, is also an antibiotic. So that's one of the ways it creates massive leaky gut is it, kills your biome and disrupts your biome and causes a lot of problems. And there's a lot of people who talk about the dangers of it. Dr. Zach Bush has a lot of information on glyphosate.
Yeah.
He knows much more on the topic than I do. Another one of the most common environmental toxins, which unfortunately I'm a specialist in, are mold toxins. Approximately 50% of all the buildings in the United States have mold, and that is a governmental statistic, 50%.
Whoa,
So
that
if
is
you think you don't have mold, it's very simple. I talked to a mold expert recently who owns a mold testing company, and he's got a lot of data on a lot of different topics. So we talked at length. It was fascinating. My main takeaway is forget a mold test, forget everything. If you have musty odor in your home, that's the worst of the worst of the worst of the worst. If you have musty odor in your basement, behind a kitchen, under a sink, those are volatile organic chemicals that are neurotoxin. That's causing massive brain fog, killing every system in your body from hormones, causing inflammation, chronic kidney disease, you name it, it's affecting it negatively. And one in two buildings in the U.S. have mold. I personally, I have been sensitive to this my entire life. I revisited my childhood home when I was on the visit where I went back home, where I got my second round of Lyme disease. I visited my childhood home and found that it definitely had mold in it. And so I'd had mold exposure since childhood. It has caused me several near-death experiences and many, many illnesses from mold. So I do know this topic really well, and it is one where even fewer doctors know about this topic than the low-grade infections. And not only that, if you go to PubMed and you type in mold and mycotoxins, there is a lot of research. There are a lot of doctors and PhD people who are now coming out of the woodwork and like really getting the link between mold and illness. Your local doctor has not quite got the memo yet, unfortunately. So this is something you really have to educate yourself on, which is not easy when you have brain fog. And brain fog from mold is, putting it mildly. It often comes with blurry vision, complete inability to focus, headaches. Guess what the blurry vision is, people? That is neurological inflammation. It's either mold or Bartonella in most cases, or both, in my experience.
Yeah.
So I know I'm covering a lot of ground here. Other environmental toxins are, a big one is EMFs. So another big, and that's a big one that, I'm studying now the genomics of how EMFs are actually affecting certain people, and it's through the NMDA receptor. So we're actually getting good scientific data on how the EMFs are causing the problem. So this is not like woo-woo or something. I mean, I got, another personal story. I got POTS syndrome, and worst brain fog I've ever had when I moved into my current home here, where my bed was literally 1.5 feet through a wall from my smart meter. And I literally, it took me 6 months to figure out what was going on. And luckily I had a good colleague who helped me figure it out pretty quickly. And I got that taken care of, and that's helped me tremendously. But that's a big one. I've had friends do this. If you want to learn about EMFs, you've got to go buy a meter and learn how to do it. That's, it's not that hard. I can give you, Fiona, information. There's a company in Canada that I've used that helped. I had to buy some things to remediate my home, and the guy who owns it's super nice, and he'll sell you the meter, and then you can call him when you get the meter and say, how do I use it, and can you walk me around the house, and so he'll do that too. So really, really nice company there. So I'll get that information to you and your listeners if you're interested.
That's amazing.
Because a lot of these things, I know they're things that they're not easy to test for. That's the takeaway from a lot of this is it's hard. It really is. It takes what we call a high index of suspicion to figure these out, and a very patient, savvy physician, and a lot of persistence on your part as the patient. So I encourage people, if you have intuition or guidance that you might have something going on, you can't let the first 1, 2, or 3 doctors dissuade you from that. You really need to be persistent, at least until you see a specialist in that topic. And then if they agree that it's not an issue, then more than likely it's not at that point. But you can't give up easily. I see a lot of friends and family members who, I talked to the pharmacist and he said that was an issue. I didn't need to worry about it. Well, what does he know? About this topic? Nothing. And then, just some general, then I was just thinking, like, what are some general things you could do, like to assess your causes of brain fog, just testing that normal things you could be done? Well, one, of course, is that EGFR and such. That's going to give you some insight into the amount of potential ammonia and uremic influence on the brain fog. And on that same note, you actually can get an ammonia level on the Mosaic Labs organic acid test. They actually do give you an ammonia level now.
Right. Okay.
Yeah, that's cool. And then there is a Vitract, vitract.com test that looks at your biome, and it's a consumer friendly lab. You just order it yourself, no doctor rec required. And they also measure like your intestinal ammonia as well.
Oh,
So
cool.
they also look at all kinds of things. There's so many. They look at all the good bacteria, bad bacteria, and they can tell you also some of those that might be contributing to this via creation of things like methane gas and lipopolysaccharides and things like this. Yeah, so a useful test as well. But as far as just general testing go, the other thing is just look at your C-reactive protein. That's a very useful test, to tell if you've got a systemic inflammatory-ish condition causing your brain fog. And another test that I learned recently that I like, and this is another consumer-friendly test, it's called Omega Quant test. And that's just a do-at-home blood test to tell you what the fats in your body look like. Everybody's heard of, the PUFAs and the seed oils. Well, what does all that mean? This lab breaks it down. Do you have enough omega oils? Do you have too much arachidonic acid? Do you have too many omega-6s? I was getting kind of freaked out that I was having a little too much sesame oil on my stir fry. I checked my Omega Quant was perfect. So, my sesame oil was fine. I got a good brand and I know it's safe and I keep taking it. So, it can be very useful. That way, if you need to take fish oils more or less, or if what you're doing is working or not. Very easy and expensive test.
Yeah. True.
And the other thing encouraging, get it, if you want to learn about EMFs, you got to get an EMF meter. So I'm just thinking of all the things, one of the things I've become real keen on lately is, institutions seems to be failing us, right? So how do we survive in these times? You better learn, got to learn. Everybody's got to learn. Everybody's got to learn and educate themselves and through their own healing and learning, help their family, help their friends, help their neighbors learn these things too. And that ripple effect is how we produce change in these times right now, because we're in transition times and we have losing of systems and creation of new systems, and this is how we create it through citizen scientists, people actually doing research and finding information out there that the so-called scientists are missing, right? It is. I've been getting a lot of research lately from scientists who've trained themselves, and they bring a fresh perspective to the data that some people in the mainstream might have missed, or they come in with less beliefs and things like this.
Yeah, no, I totally agree there. Got to be your own advocate and own researcher, unfortunately. You can find a good GP, someone like yourself, integrative practitioner, to actually help navigate the journey and when it gets a bit hard and how to put it all together.
Right. Yeah. And on that same note, Fiona, in my practice now, just to take a step back, one of the services I'm starting to offer is for people that are at a distance and not in a territory where I can legally be their physician. I can still offer consultations. And what I'm doing now is offering people 2 consultations if they have a mystery illness or they have something they can't figure out what's going on. Or they've been seen to try this specialist, that specialist, they got conflicting data. I'm not diagnosing people. I can't do that unless I'm their physician. I'm not prescribing for people. I can't do that unless I'm their physician. But what I can do is show them what their labs are showing and how they can look at the lab data and how they can go through it and how they can communicate that through a physician, and also how to prioritize what the data is showing in their system from my perspective. Yeah.
I love that.
I love doing that. My gift, one of the best ones I have is I can just, I luckily, and it's also through my own illness, I can just know what people have. I mean, I can look at the data, it all comes in, and I just get kind of shown what the situation is. And, nobody's perfect there, but I think I can provide a good frame of reference for people, especially when you're getting conflicting information. I know there's a lot of that out there in the world right now.
Yeah.
So, yeah.
No, I would vouch for your skill set in that for sure.
Right. Thank you. And it's fun. And I think it's so valuably needed. A lot of doctors and a lot of my practice, I've spent a lot of time with the maintenance of patients and their long-term care. And that's good and all, but I can only take care of a few people. So I like making this offering because then I can actually help other people that normally couldn't see me. And so it provides me a little more personal reward, as far as giving back to the world.
Oh, nice. Well, we'll make sure to put all your details below in case people do want a super sleuth to go through all their results and help them put it together.
And also the other gift I have is just guiding people to experts, giving out my Rolodex, so to speak. Again, I'm not giving a referral, because only doctors can give referrals, but I can give like, hey, here's the list of X, Y, and Z expert on that topic that you seem to be challenged with right now. You can, do your own due diligence and see if any of these might be the best for you. Happy to do that. And yeah, happy to do that.
Nice. So have we missed anything else? Because it's a good list, but is there anything else on there that you would include when it comes to?
Yeah, I'm looking. I just went down my notes here, tying some of this together. Okay, so I think it's sort of what we started with. A lot of the things we're talking about, there's some common features: blood-brain barrier leakage, gut barrier leakage, kidney leakage. And then the other thing that sort of ties a lot of these together, which I don't know if there's a lot of research on, you might know more than me, but mast cell activation syndrome. So I did, I don't have time to do 20 hours of research for these podcasts, unfortunately. But in my brief research, I was able to see that, there is more and more research around mast cells and their influence in kidney disease. I even found one study showing a direct correlation between the marker for mast cell called tryptase. They took patients who had a little kidney disease and were on a angiotensin blocker medication, and they followed them over time, and they followed their tryptase level and their kidney function, and there's a direct correlation to the tryptase level and the decline in kidney function. And what that means is there's a direct correlation between the histamine levels produced in the body and the kidney dysfunction. What does that mean? Mast cell activation syndrome is like the giant bucket where almost all of these chronic disease processes that involve brain fog fit under. So this goes in that big chunk also under mast cell activation syndrome. The big chunk is like histamine intolerance. Well, another way to look at that's what food allergies, food sensitivities. That's one subset. Another subset, foods high in histamine. There are foods that are just high in histamine. Another subset, foods that develop histamine just because they can sit on the counter too long, right? So this is a big, big topic. The reason it is so important, though, for all your listeners to hear this is because mast cell activation is also why people feel worse when they're going through their healing process. So this Herxheimer reaction, the die-off reaction, guess what that is? That is a mast cell activation syndrome from where I'm sitting. Until I see data proving it to be something else, and maybe I'm wrong there, maybe not all die-off is mast cells, but I think a large percentage of it is. And so the long story short on that is, so mast cells are one of the first steps of our immune system that attacks infections and trying to clear infections out. The problem is in our world right now, it's just our immune system is just attacking everything because of all the things, and so these mast cells become hyperactivated. That functional genomic analysis from Dr. Bob Miller I mentioned earlier, that's his specialty, mast cell activation syndrome. So he is doing the research and leading teams of researchers to uncover all the genomics around mast cells and histamine and detoxification. And the difference between his genetic testing versus, say, genetic testing for breast cancer is he's not testing for disease. He's testing for those underlying processes which can be modulated to lower your risk of all disease. So, yeah.
Yeah, very cool. Yeah, I know you were saying before we hit record, just, he's a bit like you. Every week or every once a month, they're on a big call with doctors from all around the world collaborating. And, these people are really, I call it non-stuck science. Everyone's really interested in furthering it and understanding it and challenging themselves. And maybe we got something wrong. What have you experienced there? I mean, that's the way we should be doing science, not stuck back in the dark ages.
right? And, it's, every time I think, what you just said was so spot on, Fiona. It's because scientists have to keep their funding, they have to keep their grants, they have to not piss off their neighbor. They can't release a study that is against what their guy down the hall says. They can't do any of this because they are in a structure. Like I said earlier, we're the ending of all of these structures right now. So that's what we're witnessing right now, is the ending of these structures. So it's giving us an opportunity to like rise up. So yeah, these citizen scientists are actually coming up with a lot of cool things here, and it's just people who are motivated to become the best they can to learn what's in front of them. And I think Dr. Miller's like, I think he's late 60s, and man, he's got more energy than I do, and he's really, really good with that. Yeah, if you ever want to have him on, I'll see if he might be interested in talking to you. Yeah.
That'd be amazing.
Because I was trying to research and tie things together, but I would be bastardizing the whole thing if I tried, because there are pathways that I was going to mention here, but I was like, I'm just a baby student on that topic right now. I don't want to say something wrong on that, but there are pathways that are connecting the neurotoxins and the kidneys and on that level. And I think he might have more insight into that. And if he doesn't, I bet he knows who would. So yeah, maybe we can have him come on one of these for you. Yeah,
that'd be amazing. Talking about people wanting to come on, the Doberman wants to come on as well.
Right. Oh, beautiful. So mast cell activation, can you diagnose it with a blood test? Almost impossible to do so. Luckily, I have patients who are pretty intelligent and savvy, and they go to the specialist and they're like, hey, I'm working with this integrative doctor. He doesn't think we can really test for that. And then if you phrase it that way, the allergy doctor will say, well, he's actually right. It's pretty darn hard to, basically you have to you got to eat something highly allergic. You got to draw the blood. You got to put it on ice. You got to have a lab analyst to do it right there. Is that what actually happens when you go to get your blood draw? No, people. It's drawn, it's at room temperature. Maybe it's 100-degree temperature. Maybe they analyzed it a day later. Who the heck knows? None of those things are happening in practical world we live in. So how do you know if you have mast cell activation syndrome? Again, we could have five talks on this one topic. How do I figure it out? Here's one good way to know it. Do you get tired after you eat?
Great way to. That's a really good one.
Does your brain fog get massively worse after you eat? Is your skin red? Now, luckily, now my histamine is lower than I probably had my whole life. And so I can't do it now, but used to when I was younger. Well, I remember when I was in elementary school, the girls would write their names in my hand, and it would stay on my arm, and it would stay for like half an hour. That I forget. There's a term for that, which my brain fog is it's dermatographia. That's what it is. Yeah. Half an hour it would stay, and that's the histamine reaction there, and the histamine response. So, if you scratch your skin, do you get hives? Do you get redness? Do you get itching? That's histamine response. Histamines can affect so many different areas of your body. And I see it as not only the cause of illness, but it is one of the main prohibiting factors for people getting better, because all the treatments make the histamines worse also, because when you detoxify, the toxins ramp up the histamines. So why is this all critical? I'm bringing it up because if you don't learn how to get the histamines lowered, then you can't really heal a lot, because you always feel worse when you try to get better. And that probably caused me a long time of suffering, myself and quite a few of my patients. So now I've learned that. So I really, if you got those histamine symptoms, you really want to get those under control before you do a detox or try to take out a heavy metal or kill this infection that you've had for 20 years or do any of these sorts of things, because you can't do those things if your histamines are really jacked up. Yeah.
Yeah, no, it's a really, really good point. And that's where people generally, I've had patients come in that have seen other practitioners that are just like, any supplement makes me feel worse. I'm like, okay, we've probably got CBS and histamine going on here and mold. So let's start there. So
yeah, exactly. Environmental, like multiple chemical sensitivity. That's mast cell activation syndrome. I mean, I'm
Yes.
pretty sure that has been proven in Germany.
Yeah.
Okay, now I'm remembering a study. They did a study on the whole population of Germany. I mean, they just took random samples. They didn't check everybody, of course. Thousands of people. 1 in 5 average Germans on the street had mast cell activation issues in a research study they did. That's how common this is.
That's
1 in 5
great.
healthy people.
Yeah. And then we wonder why we've got such a rise of chronic disease going on, huh?
Right. Yep. So, I think the only other thing that comes to mind is oxalates, and
Mm-hmm.
that's sort of related to those organic acids we were talking about earlier. They're also related to the fungal and candida overgrowth issue because they are produced by those. They're also are tested in the mosaic organic acid test as well. I think Genova test as well now for the
Yeah, yeah.
oxalates, I do think. So those are another reason. And I'm not an expert on this, but are oxalates directly kidney toxic? Do you know, Fiona?
Look, I think that it hasn't been proven, but my understanding is, yeah, if you've got oxalates, there seems to be a kidney issue. And I always go that for me, that's really a kidney microbiome transaction. Because I do think oxalates is a microbiome issue. If you fix the microbiome, then the oxalate issues do tend to go away. But I do see for some people, when you get oxalates coming up, then you get all these, you're more likely to get crystallization. What I think happens is that mTOR pathway that I think you and I have spoken about before in mTOR,
Yeah.
the tubules go into hyperdilation to work that, and that's a cross reaction to having oxalates because it's trying to flush the oxalates through, so the tubules hyperdilate and stay that way. So they've just been damaged all the time because they've not got their flexibility in them, and that is a reaction to oxalates, and then it bypasses through the mTOR. See, I can't remember all the close biochemical pathways, but they're trying to flush oxalates. So if you have oxalates, tubules go into hyperdilation. That's why working on the mTOR pathway in chronic polycystic kidney disease seems to work, because you're giving the flexibility back to the tubules and stopping them dilate all the time, which then the crystals get in there and cause the cysts in polycystic kidney disease pathways. But you might not get the cyst formation in a normal kidney, but you've got this hyperdilated tubule. That's as much as I remember of the biochemistry of that one, Morgan. But
yeah, well, no, yeah. I was talking to Grace Liu, who runs a really cool gut institute. She has some great probiotics that'll help you detoxify oxalates too. We were talking this subject, and she mentioned, I can't remember because I got a little brain fog today. I think she's finding that connection that can be directly nephrotoxic.
yeah,
For sure, and the one big takeaway around all these acids is alkalinization and hydration. So you want to heal from a chronic disease, any chronic disease, almost any. Well, not there's a few maybe you don't, but almost all of them alkalinize and hydrate. Right.
yeah,
Alkalinize and hydrate. Because again, a lot of these acids are building up in the body from our gut biome dysbiosis, and those acids are they're toxic to the bladder. So a lot of men have interstitial cystitis, and they don't know why. I'm surprised a lot of mainstream gynecologists are now getting that information though. So I'm hearing a lot of my patients talk about oxalates, which I'm really excited about.
yeah. I am too. Amazing.
Yeah, and the other uric acid. So you get a lot of uric acid issues, which of course are these uremic acids we're talking about. So the uric acid also contributes to heart disease, and pain and gout. So you can get pain episodes from that. So oxalate also causes like diffuse pain of your body. Gout causes more pain localized to certain joints. These are all things I've had, so I can speak clearly on them. But the key with those, if you got any of these and you got a little pain and you're trying to figure out what it is, well, if you learn to alkalinize and hydrate and the pain goes away, then it's some sort of acid in your body that's leaving you, and you're doing the right thing. And in so doing that, you're lowering the progression more than likely of your kidney disease. Yeah.
Yeah.
The main takeaway from all of these is if you can get all these sort of things out of your system and flushed out, then that disease process that was fueling the kidney disease is now the fires went coming down, down, down. Yeah.
Yeah. No, that's good. Anything else you want to add to all of that, Morgan? Because I think you've really covered very well all these things that, can set off brain fog and kidney disease. And I guess my big takeaways with that is find the cause and work with a good practitioner to really dig down into that. And if while you're doing that, a basic thing you can do is hydrate, alkalinize your system. Because I do find, most people say the first symptom to disappear is brain fog, and that's generally because one of the first things we're telling people to do is get on an alkaline diet. So it definitely correlates to what you're saying, as we notice. Just as you alkalize, the microbiome is going to change. You're going to have starting a shift in all of that sort of stuff. We know as soon as you put more fiber, which is most of your alkalizing foods, the microbiome starts to shift towards a healthier microbiome type. So and then it's mopping up your uremic acids. And the other thing that you mentioned right at the beginning, which I think is great, is if you think that your brain fog has been caused by kidney disease, lower your protein load 7 to 10 days, see if your brain fog goes away.
Will you remind me what's in? You have an alkalinization product, right?
We do. So we always say not.
Will you remind me what all's in that? Yeah.
Yeah, the citrates. So we use citrates to alkalize because there'd been some studies done on sodium bicarb, which is what most of the kidney family people say to do. But there were some studies to suggest that bicarb at a cellular level can actually increase acidosis inside the cell. It might improve kidney and urine alkalinity, but inside the cell it could actually bump it up. And of course, we know that sodium bicarb just ruins your hydrochloric acid levels, which then if you're doing that every day, you're going to get changes to the gut microbiome. And because your whole point of, for people that don't know, of hydrochloric acid is that it will neutralize bugs coming in through the diet. So we use the citrate, so it's mag citrate, zinc citrate, and then we've got sour cherries in there, very good for clearing uremic acids. And then a bit of parsley, diuretic. We've got a high dose of taurine because I know how good taurine is for kidney disease. I was trying to sneak it into one of my supplements, so I snuck it in there, and because of its vasodilation ability. So yeah, it's the citrates, sour cherry, nettle, and then taurine. Off the top of my head, there might be something else in there. I think there's some vitamin C in one of them, maybe not we've broken it up into stages 1 to 4 and then 4 to 5 as a separate supplement. So yeah.
Oh, perfect. Okay, beautiful. Thank you. Perhaps we could go through, in a future episode, we could go through how all the things to lower that uric acid, and we could.
Right,
I can't say I'm an expert on that, but I do have a couple colleagues who are, and they've shared with me their information. So it's likely enough level of knowledge to talk about. Yeah.
Perfect. I've written it down, so you're going to get an email from me about making time. It's like harass you to get and come back on here.
Well, I always learn a lot, and it's a good exchange, and it's all it's. Just so people know, Fiona and I do this out of our own time. Neither one of us, I'm not getting paid to do this. I'm not getting percentages on any deals. I'm just doing this, to educate you all. And one of my pet peeves is people who are doing it for ulterior motives and not telling you. So from the consumer perspective, I advise all of you to always be a little skeptical on these, the influencers you're following and all the products they're recommending. They're all getting huge deals on those. And not that, I do get deals on some things too. It can be that, hey, I find something I love and then I find everybody needs it. So then I'm like, okay, I might as well get rewarded for that. That's okay. But it's one thing when it's, everybody in the world now needs to do it. Well, it's probably not the case. So I'll get off my soapbox now.
No, don't worry. I'm on the same soapbox where we're standing as tall as each other on that
one. But it's also just, I think of this, our conversations as helping people who are earnestly trying to help themselves and educate themselves out there. And I see so many confused people who come in thinking they have to do 48,000 things to get better. and it's that does not get you better. That just slows you down. You're getting in the way. Anybody who says everybody needs to do this, any book who says if you have the disease you need to always take this, it's wrong, people. Everything has to be personalized. It has to be.
Yeah.
We can all take general things. You've got products; those general things are helping people. But then when you get down to it, you get so much better with a general recommendation. If you want to get the next level better, it has to be a little more specific. Next level, a little more specific. So,
100%.
Unfortunately, I can't I can't make influencer money by saying that because, I'm not telling everybody to say the same thing. So it's not marketable what we're saying. And so less people are talking like we're talking about, but that's the truth, actually. Yeah.
Well, absolutely it is. You got to treat the person, not the disease cause, not the effect. It's like I get a lot of carnivore people on my channel where they're just like, carnivore diet will cure everybody. I'm like, I'm so glad it cured you. But I'm like, no, I've got patients where it's near on killed them or made them a lot worse. So no, I'm so glad it worked for you, but please stop putting that information on my channel because
that's another topic we could talk about, right? Why the carnivore diet cures them. Like I got very good ideas on that. I'm sure.
Yeah, well, they're oxalates, right? They are properly allergic to plants. And I will say this: there is a group of people that have proper plant allergies, and plants really, really, really do make them sick. And so the carnivore diet for them absolutely 100% works. Like I'm not saying it doesn't work; it definitely does. But for the bulk of my kidney disease patients, where we've treated over like 250,000 people now with kidney disease, I can tell you for 95% of them, they do better on an alkaline type diet, but then it has to be tailored. Some need ketogenic alkalization. Some need to take oxalates out. Some need to have slightly lower potassium. Some need higher potassium. Like, again, it's all down to, you can't generalize anything for anyone because then we're not, I wish it was that cookie cutter, but it's not.
Right. It'd certainly be a lot easier, wouldn't it? You just push a program and go to the beach.
Exactly. Longer right here doing podcasts and not lying on the beach for this exact reason. Now, if you do want a good practitioner to work with, then Morgan, you so generously said that you're now doing a lot of stuff interstate and overseas with people that just want guidance. I'll put in your details below. You can also Google Dr. Morgan Camp. His website will come up and you can contact him directly through there. But I'll put those details below. If you need help with someone Morgan is very, very good. My personal experience, he's very intuitively good at, number one, not just intuition, reading and deciphering blood tests. And two, I would say you're also very intuitive about how to put that together to know what the primary driver of someone's disease is and then point them in the right direction. So I think it takes a very special practitioner to forego God complex because they hand out God complex when you get your medical degree generally and you either decide whether you're going to take it or not. And Morgan has definitely not done that. So I always appreciate you for that, Dr. Camp.
Thank you. Yeah, well, going through all the illnesses I've been through has been humbling, we could say. I can't say I've always been as humble as I am now. There are lessons we can also learn through our illnesses, right?
Oh, yes.
Good for us.
The boring way. I always go, this is a really boring way for me to learn, but sure, thanks, buddy.
Exactly right. Well, thank you. It's been fantastic.
No worries. Thank you. If you want to know more about what we do, head to kidneycoach.com. You can see our products on there and make sure you hit like and subscribe. That way you will get notified anytime we put up more information. I will definitely get Dr. Camp back on to do a How to Clear Uric Acid Naturally podcast. But if there's anything else you'd like to hear and talk about or more information on this, chuck in the comments below. I can always reach out to Dr. Camp to get an answer. And then, of course, I'll put his website in below. You can reach him directly through the website if you want to make a consultation and booking with him. Thanks again for listening. Dr. Camp, thank you again for your knowledge, time, and wisdom, and for being who you are. We'll see you all next time. Bye.
Thank you. Can't wait.